The affirmative argues that safe injection sites are necessary because opioid overdoses are increasing. These facilities reduce HIV transmission or other bloodborne diseases, and they do not increase crime in the surrounding areas. While the opioid epidemic is a serious problem in the U.S., these claims do not prove that safe injection sites are the best solution to address this problem. Firstly, everyone agrees that opioid addiction affects thousands of Americans and that overdose deaths are a major concern of our country. However, acknowledging a problem does not automatically mean that the proposed solution is effective. A 2021 article discusses the narrative that is created of these individuals when the use of safe injection sites is implemented. The article states, quote, "The narrative nonetheless constructs people who use drugs as individuals who cannot help themselves," unquote. The same 2021 article even further goes on to state, quote, "The person who uses drugs is still an other and thus is subject to new forms of surveillance offered by safe injection sites," unquote. This causes concern for unfair treatment to these individuals who would seek help from safe injection sites. It could also prove further stigmatization of addicts, or of the complete opposite, even normalization of prohibited drug use. Another major concern is that these facilities address the symptoms of addiction rather than the addiction itself. Providing a location where individuals can consume illegal drugs under supervision may reduce some immediate risks, but it does not eliminate drug dependency. Long-term recovery requires comprehensive treatment programs, counseling, mental health services, housing assistance, and prevention efforts. Many of these safe injection sites don't implement a safe plan to address the addiction. According to an excerpt from our Department of Justice website, quote, "These facilities typically have a bring-your-own-drugs policy and no mandatory testing to determine if the drugs were purchased from criminal dealers. They also allow users to bring any drug into their facility, including methamphetamine, for which there is no overdose reversal medication," unquote. Resources should be instead focused on helping individuals stop using drugs rather than creating places where drug use cycles continue. In a place like Canada, where safe injection sites has been approved and implemented, there have been many abruptions along the way. An article from Wood and Care in 2013 states that, quote, "Many of Canada's leading health bodies, including the Canadian Medical Association and the Canadian Nurse Association, have expressed concern that this legislation places such onerous burdens on applicants that it is doubtful any new facilities will be approved," unquote. While there was facilities that got approved throughout Canada, the result of these facilities leave many of Canadians wondering if that was the correct choice. An article from 2024 discusses that the quote, "Concerns about the impacts of safe injection sites on public health and community well-being may be partly at the root of a wave of changes in government policies and urban planning surrounding the locations of such sites," unquote. The article goes on to state that, quote, "In short, despite the benefits associated with safe injection sites, their implementation has raised a number of concerns throughout Canada," unquote. The affirmative also claims that these facilities reduce the spread of HIV through clean needles. While clean equipment is important, needle exchange programs and public health outreach can achieve this goal without creating dedicated locations for drug consumption, which would be more timely and costly. If reducing disease transmission is the objective, there are less controversial and potentially less expensive alternatives available. Additionally, although some studies suggest crime does not increase around these sites, the evidence is not universally accepted. Communities can often express concerns about public safety, loitering, drug trafficking, and decreased neighborhood confidence. The sites were even banned near schools in Canada. Even the perception of increased crime can affect local businesses and residents, affecting local money flow. A 2024 article states that, quote, "The impact of a safe injection site on a neighborhood crime and disorder is not clear," unquote. Policymakers must consider these community concerns before establishing such facilities. Finally, addiction is indeed a medical condition, and those struggling with addiction deserve compassion and treatment. However, treating a medical condition should focus on recovery and rehabilitation. Expanding access to detoxification programs, mental health services, outpatient rehabilitation centers, and prevention education may provide a more direct and less risky path toward overcoming addiction than safe injection sites.